Hello kids! Today, I'm going to discuss to you about the common communicable diseases related to poor environmental sanitation, particularly respiratory diseases. Poor environmental sanitation can cause many different diseases that can affect people of all ages. The most susceptible, however, are infant and young children, as well as the elderly. Young children are easily affected because their immune system are not yet fully developed. The elderly are easily affected because their immune system is already weakened by age. Carelessness and a little regard for personal hygiene and environmental sanitation can cause epidemics. These epidemics can reach alarming proportions and claim lives if not addressed. Generally, in communities where there is poor environmental sanitation, the most common diseases that affect people are respiratory diseases, skin disorders, gastrointestinal illnesses, and neurological ailments. Air pollution is a big problem, especially in highly urbanized and industrialized areas. This can cause respiratory ailments which are often highly contagious or communicable. These are the commonly known respiratory diseases. First is the common cold. The common cold is an upper respiratory infection caused by a virus. Upper respiratory includes the nose, nasal passages, mouth, throat, and the voice box or the so-called larynx. There are about 200 cold viruses which affect people around the world. Colds are easily spread through sneezing, coughing, and shaking hands. The signs and symptoms are the following: runny and itchy nose, congested or clogged nose, sneezing, coughing, headache, mild to moderate fever, watery eyes, body pain. The second respiratory disease is cough. Coughing is the fast and explosive release of air from the lungs. This happens when the air passage is irritated or blocked by a foreign object. These foreign objects may be food particles, dust, pollen, smoke, and mucus. Coughing can also be a sign of respiratory infection. The signs and symptoms are the following: itchy and sore throat, hoarse voice, difficulty in breathing, chest pain, abdominal muscle pain. Recall a time when you had cough. Tell others about your experience. The next respiratory disease is influenza. Influenza is commonly known as flu, a viral infection of the upper respiratory system. It is spread through the air by sneezing and coughing or through direct contact of the sick person to another person. Indirect contact includes touching or using contaminated objects like books, towels, and table utensils. The signs and symptoms of these are the following: moderate to high fever, headache, clogged or runny nose because of colds, cough, sore throat, red and watery eyes, loss of appetite, fatigue, joint and body pains, and some cases of diarrhea. Another respiratory disease is tuberculosis. Tuberculosis is a very contagious infection of the lungs. It is caused by bacteria which enter the body through the nose and the mouth. Tuberculosis is spread through the air via droplets, through contact with infected person, or using contaminated objects. The bacteria can stay in the lungs of a person and become active when the person's body resistance becomes weak. Easily affected are children, elderly, people with weak immune system, and those suffering from acquired immune deficiency syndrome or AIDS. The signs and symptoms are the following: fever in the afternoon, coughing with or without sputum, blood in the sputum, chest or back pain, shortness of breath, sweating at night, loss of appetite, weight loss, feeling of tiredness, weakening and exhaustion, and swelling in the neck. Next in the line is asthma. Asthma is a respiratory disorder characterized by a wheezing sound and difficulty in breathing. The wheezing sound is caused by a narrowing of the air passage. It is usually caused by an allergic reaction of food, particles in the surroundings such as dust, pollen, smoke from cigarettes, exhaust gases from vehicles and factories, medicines and drugs, too much stress and exhaustion from physical activities, sudden change in the weather and temperature, and other foreign particles which trigger asthma attack. The signs and symptoms of mild asthma are shortness of breath, catching of breath when talking, slight tightness of chest, wheezing sound when breathing, mild to moderate coughing, and feeling of tiredness. While the signs and symptoms of severe asthma are extreme fatigue, difficulty in leaning back, loud wheezing sound, difficulty in talking, severe tightness of chest, loss of wheezing sound, and bluish discoloration of the lips and fingernails because of lack of oxygen.